The first one we'll do is similar to that, the one we saw where we were talking about the length tension relationship. So I'm going to do one that's going to take the weight of the upper limb and then sort of correct that scapular position a little bit, okay? We sort of spoke about the length tension aspect of it, but also if you're in that downwardly, let's reverse it, if you're in a good position, you can argue that through the architecture of your glenoid and your labrum, you have a bit of a passive lip on the end to support your humeral head. As soon as you come into downward rotation, you lose that. So, plus your lever arm becomes longer, so the weight of the gravity acting on the weight of the arm is magnified. So then your cuff has to work harder. It's being dragged on, etc., to stabilise that or maintain that humeral head centred in your glenoid. So we want to bring them back up. We also want to take the weight of the arm to reduce the work that's going on. So with that in mind, I'm going to do two strips. I'm going to do one that comes from the back up and across the front, and then I'm going to do one from the front that's going to come up and across the back and the scapula. So just keeping in mind axis, aim, line of pull, position. If I'm coming around the back of the axis, being the shoulder here, which position do you think the arm needs to be in to create a force up there? So what position am I going to put his arm in when I put it on? Anyone? Yeah, exactly. So I'm going to come into some extension, possibly even shrug his shoulder up a little bit. Try not to downwardly rotate them too much. So now if I do that, when the arm drops down, that's going to lengthen. It's going to give me a force vector coming back up, okay? If I come through the front, what position would I be putting him in now? Yep, so I'm going to come up through here. Again, we get upwardly rotate, retract, and we'd run that all the way down. So again, as the arm drops down, that's going to come up. If I wanted to come through the side, what position would I put it on in? Okay, getting the hang of it, pretty easy. We come up through there. We come up probably to the cervicothoracic junction, so as we drop down again, it's going to lengthen, lift up. That's very nice for elevating the point of the shoulder, okay? So actually straight elevation, which can be really nice for some of those impingements and things. Okay, you can come straight through. All right, so let's turn you this way. So we also spoke about leverage earlier on. I sort of touched on it with the shoulder, okay? I don't want to just start here because then I'm going to be trying to anchor or to generate my force close to the fulcrum, so I only have a short lever arm, less effect, plus I'm trying to anchor so it's more likely to come off. So start down here, big anchor point, long lever arm, we're going to get a much better result. We're going to be less likely to get a reaction and it's going to stay on a lot better. So pop it on there. Nice big anchor point, don't pull on there because that will shear on the skin. We need to peel this back, again with these short strips, pretty much peel it back to the other anchor point. Bring them into that short position if you shrug as well. Hold down with your thumb again so I'm not shearing on the skin. Smooth down with my fingers and then stick down. Okay, doesn't need to be really strong, that one, and it's just going to start to take a little bit of weight. Now you usually find you'll need at least 2 layers over the shoulder in an adult to give you sufficient force. Depending on the size, you can probably come in and use the wide one as well, so we might try that. Yep. So, and one of the big things, getting that approximation force really, I think, helps them to recruit their cuff really nicely. So, okay, so we can turn out through there. Again, I'm going to start with a nice long lever arm. Leave yourself a little bit of space from the cubital fossa, though, otherwise every time they bend up, they sort of bunch up the end of the tape. So just leave yourself a little bit more space there. Now, if we turn you around again this way for me. If they are quite painful and you need to be a bit more passive about it, you can actually come in, support them like that, then you can still anchor, smooth down, or some people like to come in and grab them under their arm, okay, and you can still do that. It's a bit, so anchor, come through. If you want to do a posterior glide on the humeral head, you can come through there. That's where that hold underneath is nice because I can anchor here, smooth down, then I can actually slide up, do a posterior glide, upwardly rotate that scapula, okay, and bring it all in one go. And then run it down. Okay, keep your tension on. Just draw your shoulder blade back a little bit more. That's it. And then a nice big anchor point at the other end. Okay, so when they drop down again, they start to get that Feel that elevation, that lift and take some weight. Okay, weight of the upper limb. All right, fairly straightforward one. I find something or a variation of that very nice for probably 80% of my shoulders as a first go-to, because it takes weight off or load off so many structures. But for some of your neural tissue ones who might be coming in trying to take weight and that drag off your neural tissue, some of those AC joint subluxations, your glenohumeral subluxations in your strokes, your subacromial sort of pain syndromes, your impingements, your bursitis, any of those things that can be really, really nice. Okay? Just watch that there, it's a bit tight through there. They can get a reaction here where you turn that corner. This is again why that sideways stretch is really important, but sometimes it can just pull on the skin. We can see there's probably a bit too much tension. So just watch those. Yep. Okay, and the key here is that you've got to finish well off the scapula if I'm trying to directly mechanically affect scapula relative to trunk. So if I just finish on here, I can be generating a force between humerus and scapula, but not really between scapula and trunk. So I've got to pull off back to an anchor here somewhere. If we wanted more retraction, then it's simply a matter of just changing your line of pull and maybe starting something, you know, more around the front. Again, start on skin. We could come around this way. We could pull it back. All right, a bit lower. Come around there. Take up the tension. Come back, and we can now get a line of pull this way to create more of a retraction force. So it is really all about looking at what you need. As I mentioned earlier, to get that nice elevation, you can actually do this way. Shrug up for me, and bring them that way. Come straight through over the point of the shoulder. So when they drop down, okay, that really carries the weight of their arm and elevates that shoulder quite nicely.